Hello, everybody. This is Gary. Today is Friday, February 17th, 2023. It is 12:59 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my coping with schizophrenia blog entry for today. Today, my paranoia levels are very high. My delusions are very strong. I think people are plotting against me, following me, spying on me. I haven't gone outside yet today because of my paranoia. My depression is pretty severe. My anxiety levels are very high. My auditory hallucinations are pretty intense. Um, I will be seeing my peer support specialist next week and my therapist the week after that. Um, it's harder for me to go outside when my paranoia and delusions are very, very strong and my anxiety levels are very high. Um, when I'm paranoid, I don't like to be around other people. I don't trust them. And sometimes I don't trust myself. So I'm having a very difficult day today. I am trying to stick to my daily schedule. I will try to go outside for my physical therapy and walking exercises. I've already done some work on my computer. I do consumer surveys for extra money. Um, there's not much else going on right now. Of course, I still have pulmonary fibrosis in my lungs. I'm seeing a pulmonary specialist on March 28th. They're going to do some tests to test the strength of my lungs, and then I'll be seeing the doctor right after that. I don't know how advanced the pulmonary fibrosis is. Pulmonary fibrosis is when something irritates the lungs, like a chemical, and causes scar tissue to form in the air sacs of the lungs, making it more difficult to breathe because it's more difficult for the lungs to exchange oxygen and carbon dioxide, making it more difficult to breathe. I haven't had a cigarette in 13 months, so I don't know if it was caused by cigarette smoking or not. The only other chemicals that I could think that I was exposed to was pesticides and Clorox when I cleaned my apartment with bleach. Um, I don't use those bug sprays anymore, and I stopped cleaning my apartment with bleach. But we don't know the actual cause yet of the pulmonary fibrosis. My primary care doctor did say my blood pressure was extremely high, so now I'm on 3 blood pressure medications. We didn't change any of my psychiatric meds. When I saw my psychiatrist 2 weeks ago, we kept everything the same. He did ask me if I wanted the option of taking an extra 5 milligrams as Zyprexa for paranoia and delusions, but I said no because every time I take a higher dose of Zyprexa, I end up with urinary retention, and then I end up wearing a urinary catheter for 2 weeks, and then having to see the urologist to have it removed. So I don't want to go on to a higher dosage of Zyprexa. I'm going to stick to the 5 milligrams twice a day that I take right now. Um, there's not much else to report on. I'm having a rough day, but I'll survive. Like, comment, share, subscribe.